I'm Dr Helena Popovic, and after 30 plus years in medical practice, I realise there's a lot missing from modern medicine. Education is more powerful than medication, and our decisions have more impact than our DNA. Your brain booster for today is get a can-do jar, not a candy jar. If you're at home right now, go and find a lovely big glass or ceramic jar. Or if you're listening in the car driving to the shops, tell Siri to put glass or ceramic jar on your shopping list. And if you aren't able to follow instructions at this very moment, put it on your to-do list when you get home. And for the record, I've renamed my to-do list my playlist, so it puts a positive, playful spin on the day's tasks. Okay, then get a nice piece of paper which will stick on the jar, so make it match or contrast or look aesthetically pleasing in one way or another. And in your best handwriting, write can-do jar. That's C-A-N-D-O, new word, jar, J-A-R. Why? This will be your visual reminder of the power of language and labelling. Can the way we speak to ourselves boost the functioning of our brain? Absolutely. So from now on, you're going to cut that four-letter word can't, C-A-N''T, out of your vocabulary. And if you do say the word can't, you have to put a gold coin or a paper note, whatever money you have on you at the time, in the jar. And when the jar gets full of money, which hopefully it won't, donate the money to your favourite charity. Because the word can't chokes our brain. It's like putting the brain in a straitjacket or giving the brain a restraining order. Now, I know this sounds simplistic because we tell young children there's no such thing as can't, or at least my parents used to say that to me, because our brain is very sensitive and responsive to language. Everything you say to yourself, either out loud or silently inside your own head, has the effect of giving your brain cells a set of instructions. If I predetermine that I can't do something, I literally close off my ability to see how it can be done. I won't notice if an opportunity presents itself that would help me solve the problem. And it isn't only the word can't, it's all those euphemisms we have for can't. It's too hard. I'm not cut out for that. It's not possible. And the most dangerous of all, I'm too old for that. Be careful what you think, because your brain will soak up the words and deliver on them. Have you ever walked in on someone and they're in this really big fluster because they think they've lost something important and they're convinced it won't be found again? And you say, settle down, let me have a look with a fresh pair of eyes. And they'll insist, don't waste your time, I've looked everywhere and I'm sure someone's taken it or the cleaners have thrown it away. But you persist. What are you looking for? So they sigh and they say, a set of keys. They're on a silver keychain in the shape of the Statue of Liberty. It was a souvenir from New York and I'm really upset I've lost it. So you calmly scan the room, maybe move a few pieces of paper around, and there behind a coffee mug are the keys and keychain. How did you find it so quickly when your friend was convinced the keys had disappeared? Because your friend had worked her way into a state of mind blindness. You see, when we're stressed, we develop tunnel vision, both literally and figuratively. We lose our capacity to see options. We feel stuck in a rut. It wasn't your fresh eyes that led you to find the keys. It was your fresh brain. So the words, the grammar we use to describe ourselves and our world actually modify how our brain works, how we see our own possibilities, and how we act in the world. Negative self-talk decreases brain connections related to confidence and reward. It reduces motivation. It harms mental health. Negative self-talk can trigger the release of the stress hormone cortisol, which damages cells in a region of the brain called the hippocampus. And since the hippocampus, among other things, is our learning and memory warehouse, cortisol erodes our ability to think clearly and retrieve memories. So it turns the negative self-talk into a self-fulfilling prophecy. So I want you to realize that language is more than a neutral medium for describing ourselves and our experiences. Language actually shapes our experiences. Now, I'm sure some of you are listening and thinking, okay, but there are times in life when things aren't going to plan. How do I turn my self-talk around? when things feel really hard, when I'm ready to give up? How do I get my brain to work for me to find solutions and solve problems? Simply cutting out the word can't leaves a vacuum in our vocabulary. So from now on, whenever you feel like saying the word can't, or it's not possible, or something similar, swap the word can't for the word how. Don't try to convince yourself that you can do something if you don't believe it. Instead of saying, I can't find time to exercise, say, how can I find time to exercise? Instead of, I just can't get into exercise, I don't enjoy it. Ask, how can I make exercise enjoyable? Instead of saying, I can't get through to him, ask, how can I get through to him? Instead of saying, I will not get this done on time, ask yourself, how can I get this done on time? Just ask the question and go about your day. This is known as shifting linguistic categories, going from a statement, I can't do this, to a question, how can I take the first step to accomplish this? And the beauty of it is, you don't have to brainstorm the answer, because what you've done is programmed your brain to scan your environment in search of clues to solve the problem. Just go about your day and the answer will come to you, I guarantee it, in one way or another. You might be reading the newspaper and an article there happens to be discussing the issue that you've been grappling with. And you think, what a coincidence. No, it's not. You might be listening to the radio and there's an interview going on exactly on the topic that you needed an answer to. Or you might be speaking to someone and they say something that triggers an idea to get you going. It will feel like a coincidence, but it isn't. It's your subconscious mind at work. This is much more powerful than traditional positive thinking, where you repeat over and over, I can do this, I can do this, I can do this. Because if you don't believe you can do it, you'll end up having a debate in your head about why it isn't true and it won't work. In contrast, when you ask a question, you activate more regions of your brain, and without you realizing, your brain starts going through its stored information to pull out whatever might be useful to the situation at hand. And you think more creatively. In one experiment, people were given a series of problems to solve on paper. Everyone was given the same set of problems, which they had to solve individually, but they were randomly assigned to one of two groups. The people in group one were told, before they were given the problems, to engage in traditional positive thinking and to write down 20 times, I can solve these problems, I can solve these problems. Group two were told to write down 20 times, how am I going to solve these problems? How am I going to solve these problems? They were then handed the test papers and given the same amount of time to work on them. Who do you think did better? Who solved the problems more quickly? The I can do this group or the how can I group? I'm sure you guessed. Groups who had written the question, how am I going to solve these problems, consistently outperformed people who had merely repeated the positive statements. And that's because questions encourage a more active and critical cognitive process. Your brain has to engage with information. It has to consider context. It makes connections, and it enhances memory, creativity, critical thinking skills, and problem solving. There is a caveat here. If you already believe that you can do something, but you're just not feeling on top of your game, and if you can bring up a past memory of success, then reminding yourself that you can do something can work. But if you're trying to convince yourself that you can do something without any evidence, you'll just get frustrated and come to the conclusion that positive thinking doesn't work. Positive thinking works if it's done strategically. I actually prefer to use the term constructive thinking rather than positive thinking because that's what you're doing. You're using your thoughts to construct new possibilities. Let me give you a beautiful real-world example from one of my patients. I'll call her Jenny. Jenny hated exercise. She told me she was never sporty, didn't like to move, and just hated the whole gym scene. Every time she came to me, I'd offer suggestions. Zumba classes, yoga in the park, bushwalking, ice skating. I was really trying hard to think outside the box. But nothing interested her. So I told her to try an experiment. I said, start asking yourself, how am I going to get into exercising on a regular basis and enjoy it? Now, one thing Jenny did enjoy was catching up with her next door neighbour, who I'll call Laura, over a cup of tea every day. And Jenny's neighbour was equally unenthused about exercise. Not long after Jenny had started asking the how question around exercise, she was flipping through a magazine and saw an advertisement for hiring gym equipment. And she thought to herself, what if Laura and I each hired a piece of exercise equipment, and instead of chatting over a cup of tea, we chatted while one of us was walking on a treadmill and the other was pedaling on an exercise bike. At least the conversation would distract them from the tediousness of the exercise. That was what she thought. So that's what they did. They stuck with it. But after 6 months, Jenny came to tell me they'd returned the exercise equipment, and my heart sank. Then she went on to say the reason they didn't want their rental equipment anymore was because they decided it was much more economical to buy a stationary bike and a treadmill because they were going to use them indefinitely. And in fact, they have become really competitive, and they've incorporated all the exercise tips and tricks I'll be discussing throughout this podcast. Even I could hardly believe it, because I'm telling you now, if Jenny was able to go from exercise aversion to exercise enthusiast, anything is possible. So here's your call to action. What's something you want to accomplish, but you've been telling yourself you can't for whatever reason? It's too hard, I don't have the time, I'm too old. Ask yourself, how can I make a start on this? How might I make it possible? And just watch what unfolds. You don't have to see the entire path before you get started. Just take that first step and the next step will reveal itself. And then each subsequent step will reveal the next step. Okay, today's health headline is, the language of medicine is making us sick. Have you ever noticed that the language of modern medicine is actually the language of war? Western medicine wants to fight the infection, kill the virus, eradicate the invaders, irradiate the tumour, cut out the cancer, defeat the disease, and wage war on obesity. In medical speak, drugs and various therapies are referred to as armamentarium, and you must follow doctor's orders. Isn't that extraordinary? But wait, there's more. We also talk about battling the illness, combating side effects, struggling with weight loss. Even outside medical settings, people are flogging themselves at the gym, whipping themselves into shape, and having a grueling workout with their trainer. And we're forever looking for that silver bullet. This is major warfare we're talking. So what's wrong with this approach? Everything. For a start, in war there are always casualties, whether the battle is won or lost. So the warfare approach leaves us with collateral damage to our bodies. This contradicts what I learnt on day one of medical school. Primum non nocere. First do no harm. That's Latin. Sorry if I didn't pronounce it properly. Secondly, this kind of language makes us regard our bodies as a battleground. Whatever happened to treating the body like a temple? The language of medicine is giving us mixed messages. On the one hand, we're told to look after your body, and the next minute we're waging war on our body. No wonder it's difficult to sustain a healthy lifestyle. Messages are fighting the body and are creating a subconscious resistance to looking after our body. And thirdly, the language of war creates fear, anxiety, and stress, all of which are counter to health and healing. What an enormous difference it would make if we spoke in terms of nurture and support instead of killing and fighting. Whether we're aware of it or not, we automatically tense up in response to words relating to combat. And we immediately relax when we hear the language of love. Healing happens when we feel at peace with ourselves and with life, not when we're at war. In 2005, scientists from the University of Maryland School of Medicine in Baltimore measured changes in blood flow in people who were shown one of two films, either the war film, Saving Private Ryan, or the comedy, Kingpin. And what they found was that those watching the war film experienced a 35% constriction in blood flow, which increased the stress on their heart. Those watching the comedy experienced a relaxation response in their blood vessels, in their blood vessel walls, and increased the efficiency of their blood flow by 22%, thereby reducing strain on the heart. That's a difference of 57%. Language, imagery, and emotion have a much bigger impact on our health than we realise. Now, let me reiterate that I'm not rejecting everything modern medicine has to offer. Oftentimes, it's life-saving. If my appendix is just ruptured, I want immediate surgery. But the language, the metaphors, the imagery of modern medicine is counterproductive. Why can't we talk about strengthening our immune system, building up our blood cells, enabling our organs to do their job, and supporting our bodies to restore health? Don't you feel better just hearing me say that? Instead of, don't worry, we'll kill the virus that's invaded your liver. How can I not worry when there's killing and invading going on? Changing the language of medicine would restructure our whole approach to treating illness, because love builds up, not tears down. Love protects, not harms. Love makes us feel safe. It's what enables us to take the hard steps of exploring the deeper nature of what's going on. And another important point about the language of medicine, you realise that doctors are practicing medicine. They're still only practicing, so they mustn't have the hang of it yet. I don't want anyone practicing on my body. I want someone who knows what they're doing. So, what are we going to do about this language problem? If you want to change anything, you have to start with yourself. You and me, as individuals, need to mind our language. So let's start by noticing how we speak about our body. Notice how you speak about getting healthy. Is it a chore? Is it a drag? Is it something that you feel is enlivening? How does your language reflect that? How do you speak about dealing with illness? How do you define illness? Do you see it, as I said in the first episode, as a disaster, a dread, a defect, a demerit point on the scoreboard of life? Or do you see it as a doorway, a potential for greater life enhancement and experience? And how do you talk about your experience of aging? This is another topic that I'll delve into deeply, because ageism is rampant and it is actually making us age faster. So let's consciously choose the language of love. By all means, enjoy a challenging session at the gym, but not a brutal workout. Same workout, different language, different emotional impact. Talk about that exercise in terms of nurture, not torture, because that's what it genuinely is. In fact, why not get rid of the term workout and replace it with play? More often than not, we associate work with something we have to do and not want to do. Confucius say, choose a job you love and you'll never have to work a day in your life. So if you like working, feel free to call exercise a workout. If you don't enjoy working, then call exercise play or movement or invigorating or an invigorating exploit. Whatever works for you. When we change how we label something, we change our experience of it. And if you don't enjoy working, it's time to reevaluate how you earn a living, because feeling stuck in an unfulfilling job is not doing your health any favours either. But that's for a whole other podcast. When COVID happened, I so wanted the government to put out messages of encouragement. Things like, hey everyone, There's never been a more important time to get healthy and strengthen our immune system so we stay healthy in the face of this unknown new infectious disease. Here's how to build and maintain a healthy immune system. Prioritise 7 to 9 hours of good quality sleep every night. Stay in touch with family and friends in whatever way you can, in spite of social distancing, because supportive relationships measurably strengthen our immune system. Engage in whatever form of physical exercise you can. There are so many free online programs to choose from, you won't be in social isolation long enough to get through them all. All fresh vegetables are immune superfoods, especially the colours green and purple. Green and purple also happen to be the most brain-boosting colours in terms of fruits and vegetables. Get at least 15 minutes of sunshine every day and spend as much time in nature as is feasible under the circumstances. They're the kind of messages we should have put out through COVID. And there are plenty more. That would have been a really great idea, an uplifting focus that could have been repeated over and over in all manner of different ways. Unfortunately, the main thing we heard was, sit tight until someone comes up with a vaccine. Oh, and in the meantime, here's how many people died today. Asking people to passively wait in the midst of ongoing bad news and major upheaval is just adding fuel to the bonfire of stress and anxiety. So let's stop fighting diseases and instead start looking for the messages of love they harbour. What's missing from modern medicine? What's missing is an understanding of what constitutes true medicines. And what are true medicines? True medicines is an acronym for the foundations and fundamental principles of great health and healing. The letters T, R, U, and E give you the foundations, and the letters M, E, D, I, C, I, N, E, S give you the fundamental principles or the essential ingredients of great health and healing. They give you the fundamental principles of boosting your brain, enhancing your immune system, and living longer, stronger, and happier. And today, what I'll do is I'll just run through what each letter stands for and give you a brief explanation. Going forward with each podcast, we'll explore each principle in greater and greater depth. The most important point about true medicines is to open your mind to the fact that medicines don't just come in the form of pills, powders, potions, or lotions. Sleep is truly medicinal. So are food, exercise, and positive social interactions. And when people hear me say that, many of them roll their eyes and say, oh, yeah, of course. But deep down, they don't truly believe that what they can do for themselves, the way they choose to live, work, play, love, and talk to themselves, most people simply don't believe that these non-drug therapies are far more powerful than any prescription medications or surgery or radiation. Healing starts from within, not without. So let the adventure begin. Let's run through the acronym. The letters T and R in TRUE go together and stand for take responsibility. The first pivotal step is deciding to take responsibility for our own health and healing and believing that you can. Now, when I say this, I often get pushback in the form of, so you're blaming people for their disease? No, absolutely not. Nothing could be further from the truth. Taking responsibility is about empowerment, not blame. Taking responsibility is about how we play the cards we're dealt. The choices we make in response to our individual susceptibilities and experiences are what determine the quality of our lives. That's very different from pointing a finger of blame. Taking responsibility does not mean we have to go it alone. It doesn't mean we can't get help from others. It doesn't mean we can't lobby governments for legislative change. It just means we can't sit back and leave it all up to others. And when it comes to our health, we definitely can't leave it up to the medical profession because there are glaring gaps in our healthcare system. Life is full of ups and downs. We can't control everything that life throws our way. What we can control is how we respond to it. And that's where our power lies. That's what taking responsibility means. Tapping into your personal power. Taking responsibility for what you can, for what you eat, how much you move, how you communicate, the quality of your thoughts. Taking responsibility means knowing there is always one small step you can take to improve a situation, to enhance your health. As I said earlier today, you don't need to see the entire path. You just need to take the first step because each step you take will reveal the next. It's like climbing a ladder. Each step allows you a high vantage point. So if you're currently facing a difficult situation, health-related or otherwise, what is one thing you can do to improve it or to lift yourself up? Because the better you feel, the better your brain will work to solve the problem. So that's TR, take responsibility. The U in TRUE stands for understand. Understand that modern medicine is not a path to healing. The role of modern medicine is to keep us alive long enough to allow us the opportunity to heal. I introduced this idea in my previous 2 podcasts. The E in TRUE stands for examine. Examine your BS. And BS stands for beliefs and self-talk. This is something we'll explore in great detail in upcoming podcasts because our beliefs drive our biology and our self-talk serves as a sword because a sword is a symbol of both destruction and restoration, depending on the heart and hand that wields it. The double edge of a sword, like our self-talk, reflects the dual nature of our power, the ability to harm or heal. In battle, a sword can wound, sever flesh, and end life. It represents conflict and dissonance. In a different context, the same sword can protect, defend, and cut away what's corrupt. Words, like blades, can pierce deeply, wounding ourselves and others with cruelty or deceit. But words can also bring clarity, honesty, love, healing. Ultimately, the sword metaphor shows us why we need to take responsibility for our self-talk. When guided by compassion and wisdom, the sword, our self-talk, can become an instrument of healing by cutting through fear and disempowerment to reveal truth and peace. So there you have the foundations of great health and healing. Take responsibility for your own health and healing. Understand that the role of modern medicine is to keep you alive long enough to give you the opportunity to heal. And E, examine your BS, your limiting beliefs and self-talk. And the fundamental principles of great health and healing are encapsulated in the acronym MEDICINES. M stands for meaning and purpose. Without meaning and purpose, we don't have the will to live. E stands for, I'm sure you can guess, exercise, because movement is medicine. D stands for, I'm sure you can guess that one too, diet. Every meal is an opportunity to heal. I stands for intermittent fasting, fast to last. C stands for connection. People are more powerful than pills. I stands for intention and imagination. Our decisions are more powerful than our DNA. N stands for nature, because nature nurtures us. E stands for emotional expression. Feel your feelings. Don't flee from your feelings. And S stands for sleep and stress management. Sleep it off and turn stress into success. We need them all. Medicines. Without them, we might survive, but we won't thrive. That's a lot to unpack, so we'll address each medicine one at a time in future podcast episodes. Because now, it's time for the weather report. Today's weather report comes from Melanie in Coffs Harbour.
I recently heard that dementia was the leading cause of death in Australia. I'd like to know whether you can explain how somebody dies from dementia. I thought dementia was largely about memory loss and thinking ability.
Thank you for that question, Melanie. It is something I'm often asked when I speak at conferences about how to boost our brain and defy dementia. Now, firstly, dementia is not only the leading cause of death in Australia, but also in the UK. And it's the 7th leading cause of death in the US and worldwide. How? The reality is that dementia is far more than forgetfulness. And if a person doesn't have a robust support network to help them implement the lifestyle interventions I discuss in my book, Can Adventure Prevent Dementia?, the dementia will progress to a whole brain disease that eventually affects the body's most basic functions: walking, swallowing, fending off infections, and ultimately staying alive. But I want to emphasise that even though we don't have any drugs that will cure dementia, we do have lifestyle choices. And I don't even like the word lifestyle in this context, but I don't know how to better express it. The point I want to make is that just because something doesn't come in a pill doesn't mean it isn't powerful. The choices we make every day about what to eat, how to move, how much we sleep, avoiding stress, nurturing good relationships, learning new skills, doing things that bring us joy, meaning, and purpose, all these things are more powerful than pills. People are more powerful than pills. Playfulness is more powerful than pills. Purpose is more powerful than pills. Because these things can slow the progression of dementia and in many cases cure it. But, and it's a big but, it requires a big concerted effort by the person with dementia and the people around them. Healing is labour intensive, and we're not used to managing medical conditions through self-examination and a major life overhaul. But that's when it's going to take with a disease like dementia. Big sigh, because we don't want healing to be hard work. We've been trained to expect that silver bullet, but there isn't one. And if we don't see immediate results, we give up, or we presume that what we're doing doesn't make any difference. We live in a quick fix culture, which is a huge impediment to healing. Dementia does not develop overnight. It develops over decades. So healing is not going to happen overnight. It doesn't have to take decades to heal, but it can certainly take months to see measurable improvement and even longer to see the disease reversing. However, taking responsibility and bit by bit implementing all the weekly brain boosters I discuss in this podcast and doing everything I list in my book, Can Adventure Prevent Dementia?, is so rewarding and fulfilling on every level, even beyond healing the disease. Dementia can truly be a doorway to a more active, meaningful, joyful, socially connected life. But we have to start by reassessing our values. The sad thing is that doctors are not trained to prescribe self-reflection and behavioural change. Doctors are not trained to coach you through an overhaul of what you eat and how you manage stress. If you're lucky, your doctor might mention diet, exercise, and stress management as an afterthought. But the corollary of that is that the patient, you, also believes that how you live your life doesn't make much difference to your disease. If the doctor's not making a big fuss about it and not emphasising it, then you think it's not important. But nothing could be further from the truth, which is precisely why I've started this podcast, to show that how we live our lives makes all the difference to whether or not we get sick in the first place and to whether or not we ultimately heal, even those diseases deemed to be incurable, like dementia. I know they're very bold and controversial statements, but that is my personal and professional experience. Okay, rant over, back to Melanie's question about how someone dies from dementia. To understand the mechanisms, it helps if you picture the brain as the control centre for every system in the body. And untreated dementia slowly and irreversibly damages this control centre. Over a period of years, the damage spreads from areas responsible for memory and thinking to areas controlling movement, reflexes, digestion, swallowing, and even breathing. And they can't even communicate pain or discomfort. And any one of these issues sets off a domino effect, leading to one health problem after another. So it's these complications rather than the memory loss itself that ultimately cause death. If we look at the impact of, say, just difficulty swallowing, the medical term for which is dysphagia, and this is actually one of the most common pathways leading to death, as dementia damages the part of the brain that controls swallowing, a person can actually forget how to swallow, or they lose the coordination needed to swallow properly. And when that happens, they're obviously at risk of choking because food or liquids can go down the wrong way and block the airway. Also, obviously, if a person can't swallow, they won't consume enough food or water, so they get dehydrated, they suffer from nutrient deficiencies. That then leads to weakness, frailty, and organ failure. Probably the most common cause of death in advanced dementia is what is known as aspiration pneumonia. Aspiration means that food, drink, or saliva accidentally enters the lungs instead of the stomach. And because the person can't cough strongly enough to clear it, bacteria grow in the lungs, causing pneumonia. The problem then becomes that their immune system is usually too weak to clear the infection, and then breathing becomes increasingly difficult, and eventually the body can no longer cope. And even in the absence of aspiration pneumonia, a person with dementia becomes increasingly vulnerable to all types of infection because the more the dementia progresses, the less the brain is able to regulate the immune system. So another common infection that can lead to death in someone with dementia but is like nothing in a healthy young person is a urinary tract infection, a UTI. UTIs are especially likely to happen when a person becomes incontinent or needs a catheter. And in advanced dementia, a UTI can spread to the bloodstream, causing sepsis or septicemia, which is a life-threatening body-wide infection. Another big issue is that in late-stage dementia, people often spend most or all of their time in bed or in a chair, and immobility leads to a cascade of physical decline. People who can't move independently frequently develop pressure injuries called bed sores, especially over bony areas, which is why you need to frequently change a person's position, because these bed sores can become infected and also lead to septicemia. And as the body becomes frail, what would be a treatable infection in a healthy adult becomes potentially fatal for someone with advanced dementia. Other problems that ensue from immobility, you can probably guess a lot of them. Muscles waste away. Circulation worsens. The heart and lungs weaken. Blood clots can form in their legs. You've probably heard of leg clots. They're known as a deep vein thrombosis or DVT. And the clot can then travel to the lungs and cause a pulmonary embolism. And a pulmonary embolism can be fatal by blocking blood flow in the lungs, which causes a lack of oxygen that can damage the heart and other organs. If a person has a large or multiple clots, these can lead to a very rapid increase in pressure in the right side of the heart, the right ventricle, causing it to fail, which can lead to cardiac arrest and death. Eventually, when dementia reaches its final stage, basically the entire body enters a process called systemic failure. And this stage often resembles the end of life from any terminal illness. They sleep most of the time, their appetite fades, swallowing becomes nearly impossible, their breathing patterns change, their body cools, and their organs begin to shut down. Fortunately, this is not usually painful, so the person actually appears peaceful as they gradually slip into deeper unconsciousness. And death occurs when their brain can no longer regulate essential functions like breathing or the rhythmic pumping of their heart. In a nutshell, dementia weakens the body until a relatively minor medical problem becomes fatal. So the cause of death might not actually be dementia. It might be recorded as pneumonia or septicemia, dehydration, malnutrition, organ failure. But dementia is the underlying mechanism that made these complications unavoidable. Dementia creates the conditions for these final illnesses to take hold. One consoling thing about passing away with end-stage dementia is that the person spends most of their time asleep, and so they no longer experience any distress that we're aware of. This is one area where modern medicine does make a contribution: palliative care. It's very humane, very compassionate, and excellent at providing comfort. When it comes to relieving pain, anxiety, or breathing difficulties, should they arise, palliative medicine can manage these very effectively to ensure that a person's final days are peaceful. Please note that this podcast is for general information purposes only. It does not constitute medical advice and is not intended to provide specific guidance for any particular situation. The use of this information is at the viewer and listener's own risk and is not a substitute for consulting a healthcare provider.